Hello, everyone. I'm Daryl Moore, and I am a co-chair of the HBA LGBTQ plus committee. And I'm honored and excited to have Katie Caldwell and Dr. Joseph Gath here today to talk about the parallels between the COVID and the HIV pandemics. If you don't know Katie, she's the CEO of Legacy Community Health, one of the largest HIV clinic offerings that started a long time ago when it was very small, and she's grown it to something tremendous that serves so many communities. She is a community health trailblazer. I've known her for a long, long time, and I'm proud that she is joining us today. I haven't known Dr. Gath. I've known of him. He has one of the largest HIV patient populations in the nation. He's been doing what my grandmother would call, he has a public servant's heart. And he's been doing that since the mid 80s. And he also is involved with treatment of COVID patients. And so we have two great folks today to talk about the parallels and the differences. And I'm gonna, now that I've almost introduced them appropriately, I can't do it well enough. I'm gonna turn it over to Dr. Gath to get some sort of general perceptions he has about the two pandemics.
Daryl, thanks so much for that kind introduction, and privilege and a pleasure to be on the panel with Katie to talk about the parallels between the HIV and the COVID pandemics. We could spend an hour just talking about just the basic things with that, but I decided to spend maybe just 7-8 minutes just to give you the high points of the facts of the adversaries that we're dealing with and how in many ways that they're similar. The first thing is relatively obvious. Both of these are viral infections that have very many similarities. The first similarity is that their genetic material is messenger RNA, mRNA. And it's a genetic material that's the brains, if you will, of both the HIV virus as well as the coronavirus and the COVID-19 virus. The second point of similarity, they're both zoonoses. Now, zoonosis is an infection of animals that happens to get to humans at some point in time. And because it's a zoonosis, it can grow in animals and change and come back and infect humans. With HIV, it was a primary infection of monkeys and chimpanzees in Central Africa. The COVID virus that we're dealing with now is primarily an infection in bats. And that's where it likes to grow, but it grows there, but it can come out, unfortunately, end up infecting humans. So it's very similar, and they're both zoonoses. The third thing is both of these viruses are intelligent biologic machines. They think, and they think around us, and they think despite us, and they're born to adapt, and they're born to survive. And the way they survive is by mutations. It does mutations to allow it to adapt itself to whatever environment they're in. To give you an example of how effective mutations are in them, it took 8 million years for the DNA in a human to change 1%, 8 million years. It takes a coronavirus 1 week to change 1%. That's just how quickly it can change and adapt. And while we're seeing already variants of COVID floating around our communities, HIV unfortunately did and does the same thing. And so they're very, very efficient mutation markers that allow it to survive. The second parallel point in the pandemics, these were both new viruses that humans had zero experience with when they came out. HIV, when we figured it out in the early 80s, COVID-19 in January, they're both new viruses that humans had never seen. And both led to pandemics. And the question is, why did they lead to pandemics? And viruses such as this lead to pandemics because of societal interactions with nature that have changed. With HIV, what happened, how it got from the chimpanzees out is society changed, and little small villages in Africa that never really saw each other now began to develop roads where people in these small villages would go out and get on roads and go to major cities and live. And the virus just tagged along with this transportation mechanism and brought the viruses to cities where the cities had never seen it, and it grew into a pandemic. With coronaviruses, also the changing infrastructure of humans in relationship to nature has also fueled the pandemic. This coronavirus began as a pandemic in 2002 with the first SARS epidemic. And it began pandemic, and it began because of societal interactions between China and animals. There's an animal called a civet that never really got around cities, but because there was global warming, because there's deforestation, these animals began to get closer to cities in order to be able to try to feed. And they got interacted with bats, and that particular interaction led to the virus that caused SARS. Same thing prior to coronavirus now. We're still looking at it. We think it probably began in bats. Exactly how it got into humans, we're not exactly sure. But the whole infrastructure of our interactions with nature is what fuels a pandemic. And so global warming, travel, deforestation, all of these things have led to this pandemic. And importantly, it's going to be the reason why we may have future pandemics coming up in the future. The third point with both of these viruses and both of these pandemics is they can affect anyone independent of race, gender, social status, Republican, Democrat, live in the South, live in the North, live in Africa. It doesn't make any difference where you live. Everyone can be equally affected by both of these viruses. And we learned that, unfortunately, the hard way. The fourth point is that there are no medications that can cure viral infections for the most part. The first one in the history of mankind that we have a treatment for that is a cure with a medicine is hepatitis C, which is amazing. But in the history of mankind, there are no treatments for viral infections. You can't take a pill and get over the viral infection except for hepatitis C. So the key to viral infections such as this is a message of prevention. With HIV, we learned that relatively early when we first saw the pandemic, and we tried to get the message of prevention out. And we asked for society's response, and we've asked for governmental response to the HIV and the prevention message. Condoms, safe sex, all those things we knew in the 80s to try to prevent the spread of the disease. And unfortunately, the response to society was not one that we really needed. And we didn't really also get the response from the government. We went to the government and says, we need to get this message out. Let's talk to the high schools. Let's talk to sexual activity. Can't do that. We're not talking to schools about this. We need condoms in prison. Oh, there's no sex in prison, so we're not going to have condoms in the prison. We still don't have condoms in the prison. So the prevention message still from HIV is still not there. We went to the government to say we need needle exchange programs so we don't spread the disease process with that. Didn't happen. So the prevention message is not one that is embraced by society and by governmental officials. That was HIV. Fast forward to coronavirus, and guess what? We see the same thing. Hey, we can prevent this by wearing a mask and staying away from people. No, that's my constitutional right is I don't have to wear a mask, so I'm actually not going to do that. Government, can you help us enforce this message to save lives? Well, what did we just do in Houston? No more masks. We don't have to have any more masks. And so we're doing the same thing now that we did back then when science is telling you how to prevent something. And when you turn your back, the virus is going to win. And that's unfortunate. And it's the same parallel that we've seen in the past. The fifth point I want to make is unfortunately, both of these epidemics, when they first started, led to death. Back in the 80s, when we first had HIV, we didn't even know it was HIV. Once you were diagnosed, you died 12 weeks later. We just didn't have any activity. We didn't have anything that we could do. And you died often alone. You were stigmatized. You were there by yourself. There was really nobody there to be with. At the beginning of the epidemic, as you know, affected the gay community primarily. And unfortunately, they were marginated. They felt alone. Many of their family members never even knew they were gay, much less getting HIV. And when I make the phone call, your son is in the hospital, he's very ill, please come. Well, what does he have? He has AIDS. Oh, no, he can't have that because he's not that kind of person. So we had to deal with that, plus the dying person, plus their other half may or may not be well enough to come visit. And they ended up, unfortunately, dying alone. And it wasn't a very good look. Fast forward now to the COVID-19 epidemic, and we see similar things. Once you get diagnosed and come in the hospital, you go on a ventilator, unfortunately, many people die. And it is not the same type of stigma, but it is even almost worse at this point in time because you die in isolation. You die by yourself, your family can't be there. And me as your doctor, You can't even see me. I have so much equipment on that you wouldn't know what I look like. The average person I take care of has no idea what I look like when they leave the hospital because they never see me. I have gowns on, I have gloves on, I have mask on, and I'm old. My glasses fog up. I can't see, I can't hear anymore. I can't touch you, I can't interact with you. And so you die in an isolation where you don't even have the ability to even see or talk or touch a nurse or me or have a conversation or anything else at all. And it's difficult. This is, I mean, HIV was bad watching on those folks die back then. This is very difficult too, in a different way where I can't even sit at the bedside and just hold or hug or squeeze the hand in a patient. So it is not a pretty way, unfortunately, to die. And what you see on TV is sort of scripted. We see, oh, people running around these suits and sort of, it's really not like that. It's very, unfortunately, chaotic. And so unfortunately, it's a big parallel. The final point I want to make, because I don't want to be Debbie Downer the whole way through, the other parallel to the epidemic is we have fantastic scientists in the United States and the world. Back with the HIV epidemic, when it first started, I met some of the smartest people that I've ever met in the United States and the world that were key to getting the disease under control. And many of the people that were fighting then are now also fighting the COVID-19 epidemic now. Tony Fauci is a gentleman, a scholar. All he cares about is taking care of people and getting the message out. And I have a profound newfound respect for that man. I know him personally and professionally. He's the greatest guy, but to go through everything he went through and not quit at age 80, I tip my hat. I will have the utmost respect for that man for the rest of my life. I must say, Rochelle Walensky, I know all these people are veterans for the HIV pandemic. And that's good for us because we did a lot of things right in the past, but we did a lot of things wrong. And we knew what we did wrong. And now you've got people there to say, you know what, we're not going to repeat this. We're going to get science. We're going to do what we need to do. And so we have science fighting back. And the science fighting back got us the treatments for HIV. The science fighting back now got us vaccines in record time. And you got to tip your hat to the scientists that are fighting for us in order to be able to do the disease process. And get this under control. Those are the big 6 or 7 big points I want to talk to you about the virus and the epidemic and the parallels. I'm sure other things are going to come out in time, but I hope that gives us a little bit of introduction about what we're up against and really what the parallels are. Thank you for the few minutes.
Thank you. Thank you for the introduction. Katie, you want to talk about some lessons learned from the HIV pandemic and how it's impacted what Legacy does in the COVID?
Sure. Absolutely. Some of it I'm going to kind of play off of some of the things that that Joe talked about. In the early days of HIV, first of all, we had no way to tell really that you had HIV. We did what's called immune system screening in the early days. So many of you may remember, depending if you have gray hair like Daryl and I do, you may remember when people were lining up around the block to get an immune system screening because there was basically one or two places, and then Montrose Clinic, now Legacy, was one of them that you could get that screening. But at that point in time, when you got the screening, you were told, and Joe said it, you're dead in 12, 6 to anywhere. We having been an HIV counselor back then, we would give you 6 months. And it was incredibly traumatic because, I was 28, 29 back then. And I was telling my peers, people my age, that they were going to die in 6 months. We'd never dealt with anything like that. And as a society, we had not dealt, other than in war, had never dealt with a young generation just, being hit at a death sentence. My 80-year-old grandmother at the time told me I was going to more funerals than she was back in the 80s. The other thing is the president, then President Reagan had basically a denial response. He never said the word HIV. He never said the word AIDS. He never acknowledged it. There were people like Dr. Fauci and others at the CDC that were trying to get this response, and it was basically ignored at the highest level, at the presidential level. And basically ignored the science. And at that moment in time, There was a lot of research going on. All the time we were learning more and more, as Joe said, but the discrimination was also growing at the time. And Joe alluded to the fact that people were having to go home and tell their families, not only tell their families that they were dying of this disease that people were afraid of, because again, there was so much misinformation that was going out. I mean, I had people ask me, well, can't you get it from a mosquito bite? Well, no, we knew that early on. You couldn't get it from a mosquito bite. You couldn't get it from, kissing somebody. And there was a lot of discrimination, and there already was a lot of discrimination around the gay community, and it just got worse. And then you had insurance companies, for instance, that would redline neighborhoods. And when they say redline neighborhood, it meant if you lived in a certain zip code and that's 77006 back then, you pretty much couldn't get insurance. You couldn't get any kind of insurance. Forget life insurance. You couldn't get health insurance. You couldn't get anything if you lived in that neighborhood. And then you had people that were refusing to rent to people. If a landlord thought you were gay, back then they would deny you an apartment to rent. And they could deny that. And then there became the whole fear of, if somebody died in this apartment, oh my God, I don't want to live in a place where somebody died, especially died of this dread disease, because, gosh, I might get it because I was in the apartment. There was that level of bad information that was out there. And frankly, we have today, I don't know if any of you have bought or sold a house, one of the disclosures you have to do is if anybody died in that house. And that came out of the HIV epidemic. That was never a question before that. And there were a lot of you have seen pictures, I'm sure, of the protests, and there were lots of protest marches, and a very different than this pandemic's protest march. Then the protest marches were trying to get the government to pay attention to us. These protest marches are saying we don't believe the science and we don't believe the government. So very different things. But and the responses are such. But the discrimination and it's still out there. In this pandemic, we've seen a tremendous increase in hate crimes against Asians because they started calling it the China flu and blaming the Chinese people, and when that was ridiculous. But it still has had an effect, an incredibly negative effect toward the Asian community, and much like it was toward the gay community back then.
Sure. I remember when it was the gay plague. So
plague, it was. We called it GRIDS in the beginning, gay-related immune deficiency syndrome, and then moved to AIDS, and then identified the virus as HIV. So the responses and the other, Joe pointed out, but I think one thing that there are a lot of good things that have come out of the HIV epidemic, and one of them was basically the holistic healthcare model that we have now, where you don't just treat the person. You look at their housing, their food, their what we now call the social determinants of health. You provide case management, you provide behavioral health care, all to that person, because to treat the person, that we realized in the HIV epidemic, you had to look at all of those things. And frankly, that had never really been talked about or looked at before. And now it's a practice. Insurance companies are even starting to pay for it. Back then, the insurance companies didn't want anything to do with it. Now they're starting to pay for those things because they know that's what helps keep people healthy. So the parallels are there, and unfortunately, some of the negative parallels are there. But there's been so much growth and a lot. And Joe, you can correct me if I'm wrong, but one of the reasons we got a vaccine so quickly for coronavirus was because of the knowledge that was gained from learning about the HIV virus.
I want to key off something, Dr. Gath, you said, and then I want both of your responses to it. You said that the virus, like the HIV virus, is non-discriminatory, and it is true, right? It doesn't care who it infects, but it is disproportionately impacts some communities. Some people are much more affected they were by the HIV virus, and then they certainly are about the COVID virus. Can you tell us what you think, what communities you think are similarly impacted or disparately impacted between the HIV and the COVID pandemics, and how you address that in your medical practice?
So I think the parallels are this. Clearly, HIV was not a disease of a group of people, it was the disease of high risk behavior. And that's the message we had to get out, especially we were trying to get the message of HIV prevention to the African-American community that may not identify themselves as gay. Well, men have sex with men, but I'm not gay, so I don't have to worry about this. Well, it's not what you call yourself, is what you do. And so it is the behavior that you need to be aware of to try to prevent the disease process. Fast forward to the coronavirus epidemic, what we have, and Katie has already touched on it, we have societal determinants of health. We have more obesity in the African American community. We have more diabetes. We have more because of where we live and how we eat. I don't want to go through all of the details, but because of that, we now have made ourselves more of a high risk group because of the societal determinants of health. And when you dovetail that into the fact that that the African American community and communities of color are often more frontline workers, they're the Uber drivers, they're the people at HEB that are checking you out, they're nurses, they're beauticians, bartenders. We're in a position where we cannot protect ourselves. And when we even return to homes, we often return to homes that are multi-generational households. 90-year-old grandmothers in the back, mom and dad are there. The daughter just lost her job, moved in with her kid. Now you've got all these people living in a 2 or 3 bedroom house. And even if somebody does get it, there's no way you can quarantine. And so again, it has to do with the position that you're in. I think that is why communities of color are unfortunately disproportionately affected. When you factor in lack of insurance, lack of getting the healthcare and that kind of stuff. And quite frankly, the other big issue is doctors' offices aren't open. I mean, if you're sick at home, and I've got to Zoom you, but what if you don't have internet? It was amazing to me. Maybe it shouldn't be amazing to me, but the insurance companies have allowed us now to do Zoom and telemedicine. I said, oh my God, I'll be able to connect to all of my patients. It's going to be much easier to do. 20 to 30% of people, minimum, I can't do it. They don't have the phone, they don't know how to turn it, whatever it is, they can't do it. I almost can't do it after my little young people in my office setting it up. So you have issues where you just can't get to healthcare. And so it's all this is how we are in society, and it's the high risk that we're unfortunately in. And when I see people saying we're not going to wear a mask, or the state of Texas they're not going to do masks, it also disproportionately puts us vulnerable to get sick and die. And so it almost is, you're saying, well, we don't care about it. We know you're sick and dying, but we know this will help you not, but we don't care. You're going to go ahead and do it. And that is a big deal. And that's why, unfortunately, we're still saying what we're saying.
Katie, can you talk about you've been at Legacy or the Montrose Clinic for such a long time, the differences in the same, what do you see that's the same?
Now we're seeing, we saw people lining up to get tested back, in the HIV days. We saw people lining up to get tested, only sitting in their cars to get tested, now lines for vaccines. And, the other piece is that we've learned with around the vaccinations, and we learned it back in the HIV world, is people want to go where they trust people. There is a distrust, especially in marginalized communities, rightly so, of a lot of institutions for a whole host of reasons. I had an older woman tell me older than me even, tell me last week when I was at one of our clinics, and she said, well, I'm coming here to get my vaccine. I don't trust those people down in NRG. I don't know them. I don't know, but I know you. And so I trust you to give me what I need. So there is a level of trust that has to get built up, especially in marginalized communities. We have people, it's amazing to me, we have to collect demographic data on everybody that we vaccinate. It's amazing to me how many people won't check off that refuse to tell us their race, ethnicity, because they don't want the government to know it. And back in the early days of HIV, we did anonymous testing, and we fought hard for anonymous testing, which flew in the face of all the public health people. All the public health people just couldn't stand it. But we did that because people were losing their insurance if their carrier found out they had HIV. So people would come in and get their anonymous HIV test, and that way they could make the decision of how to manage it, how to manage supporting their families, and how to deal with work, because of course the majority of people get their insurance through their workplace. And now your workplace is going to know that you have this dread disease. Well, now your workplace wants you to have either your vaccination card or your COVID test to come into your workplace. And we have a lot of people that coming in saying that they have to have that to go back to work or to go back to school. And so I think that's a lot of the parallels and the similarities.
I want to talk about something that has come up, and it was fear. I remember in the 80s, people who were afraid to get tested because they were afraid of what was on the other side of it, because you said 12 weeks and you said you were a counselor. It was 6 months. I had that experience in the 80s with people that I was friends with. And so I lived through that. My perception now is that you don't have people afraid of getting tested, but you have people afraid of the vaccine, which wasn't an option in the HIV pandemic. Dr. Gath, can you talk about fear and misperceptions and misinformation and how it's impacting communities, which communities are more impacted, and how you overcome fear in treatment and vaccination?
So that's all good points. And the fear back in the day with HIV is exactly what I said. I don't want to know this because I know if I know it, I'm going to die. So I'm going to die anyway. I'm just not want to know it. And then all the things that Katie said, it just brings back these horrible memories and sights of not getting housing, and I'm positive the whole 9 yards. The fear now from marginalized communities has more to do with the distrust of the system, but not having someone they trust to explain it to. And Katie brings it up very well. There's this whole issue in the African American community about Tuskegee experiment, the syphilis. They had syphilis, they didn't get to treat syphilis the whole 9 yards. And unfortunately, we're continuing to do that whole thing. The Pfizer Moderna studies, there was not enough African Americans in the study. There was only 0.5% HIV. We had to yell and scream to get the HIV folks in, but by the end, the study was almost already enrolled. Why do we even have to have a discussion about having that? And so the distrust, unfortunately, is still there. And I'm going to bring this up too. I was very disappointed in Gilead with the remdesivir study. The remdesivir is one of the antivirals they wanted to try, and they had it at Methodist Hospital, which is totally fine with me. But I called Gilead and said, my people can't get to Methodist. We need a study site that's not Methodist out in the community. It doesn't have to be me, but I need somebody here that takes care of folks. Crickets. And then we didn't hear anything. And so people asked me, well, Joe, you know Gilead, how come you don't have access to these things? And the answer is, I don't know. And so you're asking me to fuel and explain the distrust when you're continuing to fuel the distrust at this point in time. And so that is what the concern is in the African American communities. Now, when you sit down and talk to somebody about it and explain to them why this is actually the opposite of Tuskegee. In Tuskegee, you have syphilis and penicillin came and they didn't give it to you. Here we have COVID, and now we have a vaccine to prevent it. We're actually giving it to you. It's actually the exact opposite. And yeah, the studies didn't have all of us in this, but the bottom line is we should do just as well as anyone else. And the risk of not getting the vaccine. And so when I have that conversation with folks in my practice that are marginalized in communities of color, 90% want to go get the vaccine. The problem is trying to figure out how to get the vaccine. That's another discussion item. But that's it. But they want to hear it from somebody that they trust. And me, I got street cred with the African Americans. I don't have street cred with the Hispanics. We speak Spanish and everything else. I'm a block away from the Mexican embassy, but they don't come because I'm the establishment. I mean, how do you know I'm not Donald Trump, want to build a wall and send you back over to the other thing? And so we have to have people that the community trusts to explain to them what needs to be done and why it needs to be done. And I think that's what's important. And it's same the parallel that we did back in the HIV times too.
Very much so. And, you know, we're seeing, we have sites in Gulfton and in the East End and Deer Park, Pasadena. And we're seeing, especially in the Hispanic community, you know, I'm coming here because I trust you. I know you're not going to turn me out. I know the government, but I may not give you my name. I'm going to give you a different name or a different address. Now, we don't know that. I mean, we don't have people sitting there looking everybody up on the internet to check that. But so there's still that level of institutional distrust because we're registering everybody in a database that we vaccinate. And we have to. And frankly, if you lose your card that we give you, you kind of want us to have that in the database, so that you can get another card that proves that you've been vaccinated. But there's such a level of distrust. And the other piece is to sign up for the majority of especially the mass vaccination sites, you got to go online. We have tons of patients that number one, don't have the internet, don't have a clue to get online. Good luck finding your language, you know, of origin. While they've done a decent job with Spanish and Vietnamese and a little bit of Chinese here and there, it's still, if you don't have an internet connection, or you don't know how to use a computer, you know, you better have somebody that's helping you.
Right.
Well, you brought up one thing I want to talk about. You talked earlier about 77006 and the HIV. I remember that when you couldn't get health insurance, but we know now that certain zip codes have much lower infection rates than other zip codes do, and they're predominantly wealthier white people who have lower infection rates and higher infection rates in economically disadvantaged communities of color. How do we address that? How are y'all addressing that with regard to access to these communities? Because you said it, you have to have the internet. People are sophisticated, well-educated, financially secure people have a lot more tools in their toolkit to get the vaccine, to be able to play the game, to get in the line on the internet, and to get in the queue early or to hop a spot that isn't theirs. So what can you do? What can we do to make sure that folks have access to the vaccine in the disenfranchised communities?
Well, I can tell you what we're doing. We have outreach workers that already have connections in the communities that are working with other community-based organizations as well as the churches and the other faith-based groups to do vaccinations, you know, at a church or at some place, because I will tell you, if you're trying to reach seniors, a lot of them, especially in the Hispanic and African-American community, go to church on Sunday. They may not go anywhere else during the week, but they're going to church on Sunday. Or the minister is, or priest or whatever, knows who's who in the neighborhood. And they know that Mrs. So-and-so really needs a vaccine because she can't see her grandbabies because she's afraid, but she can't get out of the house. So you work inside the community, and we've been doing that for years in these communities. So it's given us an advantage. But I will tell you, until recently, we didn't have a regular supply of vaccine. One week we would get 100 vaccines. The next week we'd get 200. Another week we wouldn't get anything. Well, now finally we're getting a consistent number of vaccines every week. So that allows us to go out and do the inreach into these into the communities to help people who don't have a clue about how to get on the computer.
Let me dovetail exactly what Katie's saying, and she's 100% right. I'll speak to the African-American community. The key to African-American community is going to be the churches. That's the bottom line. And the church is just waiting for me to have access to the vaccines where we can go out there and really have the ministers get it organized. They'll come out if the ministers say, come out and get this done. And the J&J vaccine is going to be critical for that because it is transportable. The problem with the Pfizer and Moderna, there's drama with all the code and you got to use it now. It's too difficult to take it out to the zip codes that we need to do. So Katie and them are doing what they can do by the people that can get there. We've got to take the vaccines out to these marginalized communities. We start the African American churches, and then we ask them, hey, you're in the Sunnyside zip code, your church is here. We're going to have a van here, and we're going to have 500 shots. Tell me where we need to go and how to do it. We're going to have to take the vaccines to these people and have to go find them, just like we did with HIV. It's not that we have to go out to the streets and test people with HIV. We went through all of that. We have to go out to the bars. We have to go out to where the people are with what they need to have done. And we learned that back in the day. We just need to have access to the vaccines that we know we have. The last thing I want to do is to go out to a church and have 500 people signed up and have 100 vaccines.
Right.
And then you're talking about people that are going to have distrust. Well, wait a second, Joe. I mean, what's up with this? You're supposed to be, if you can't get it, why am I going to trust anybody else to do it? So that is the key. We've got, and thank goodness, I think our new administration is going to make it easier for us to get it, and we'll be able to take it out to communities. I think that's going to make a big difference.
I mean, it already is. We did my young staff is calling a pop-up vaccination at the Deluxe Theater in the 5th Ward. And I can't tell you how many people called us. I mean, our phones went crazy because people saw the vaccine site. Well, we had 300 vaccines for that day and, booked up, but we're going to be able to start now doing that every week. So we'll be able to have that, there, and we're doing something similar in the East End.
Yeah, you talked about the administration, so I want to talk about the government and try to do it in a politically correct way where I'm not getting myself outside the lines. But my recollection of the 80s is that the governmental response was no response. And it was ignoring a problem because it largely affected the gay community, and so it wasn't their problem. My perception of this governmental response is awareness of it, but ignoring that it's a problem, even though it impacted a lot of people at the beginning. The first response was not enough information. This response seems to be misinformation, even at the government level. And so I want to talk about and get your input about what you think about misinformation in both pandemics and how misinformation impacts communities and drives transmission and non-treatment.
Go ahead, Katie, you can lead off.
Okay. Thank you. I'll stay in the rails a little bit. Well, I said it earlier, President Reagan just didn't ever say it, just ignored it. Bush 41, came in. He said the word HIV. Barbara held infected babies, opened it up, started talking about the science. The stigma it didn't go away, but there was actually a little leadership at the national level finally. And in Bush 41 was where we got the Ryan White Care Act, which actually put some money behind.
Ooh. Did we lose Katie?
Help us if anybody drank bleach. So what? It's crazy. I think my internet connection's unstable, so you may want to.
We lost you for a minute, but you're back on. Dr. Gath, you want to talk about misinformation and how it impacts your practice and what you have to do to overcome it?
Just like Katie said, we had to yell and scream to get the government to acknowledge HIV and to help us for the scientific needs, and it was a struggle, and not having the information or the governmental leadership slowed down our ability to deal with HIV in a variety of levels. I already told you about the prevention messages and things like this. Fast forward to the COVID-19 epidemic. The governmental response is one to politicize this entire issue and make it a political issue and not a medical issue. And so the misinformation that we have to deal with is to extract the politics out of it and try to get to the science. Unfortunately, the political nature of everything is the message that gets on TV and the newscasts and things, and not with the medical things. And so what I end up having to do, unfortunately, is to watch all of these channels and figure out what they're saying, so I can go tomorrow to tell the people bleach or whatever crazy thing that was said yesterday. Don't believe this. And so in a pandemic where people are marginalized and already don't believe things, the more misinformation that we have to get through is going to continue to marginalize them and go from there. And to try to get the message what really needs to be done is something that takes a lot of work. But you just have to explain to people what the right information is. The biggest driver of people getting vaccines in the African-American community is Dr. Kizzy Corbett. I don't know if you know who she is, but Kizzy Corbett is the right-hand person of Tony Fauci, who was the inventor, if you will, the Moderna vaccine. And so all I got to do is go to every African woman and say, it's one of y'all that made the vaccine. When you need something done, you call African-American woman, don't you? Yeah, well, we did. We called Kizzy, and that's what she made. All right, I'll get vaccinated, Gath. That's one of us. So those kind of messages are the ones that I think that are going to be important. But we have to continue, unfortunately, to battle misinformation. I mean, just like this mask thing, there's no definable scientific benefit for doing what was just done, period, the end. And we have to fight that. And now the people, the HEB is going to have to fight with people want to go, they want to go in there without a mask. And that's going to be on TV, not that HEB has the vaccines. HEB is trying to keep people out from not wearing a mask in there. So it's unfortunate. And I guess the point to make, this isn't going to be the last pandemic. This is just going to be one of coming. And we need to learn from all of the stuff we're doing wrong to not do any of this again, and to keep the science away from politics and do what needs to be done to prevent this pandemic, not to mention to deal with it when it comes. Because if we go through this again, then shame on us. I mean, it really is not something needs to be, because we know all the wrong things to do. And it's just unfortunately a struggle that we shouldn't have to have, but we unfortunately have to do every day.
Do you think, because the government in this response is a little bit different because it seems to be more fragmented between local, like city, county, and state level, everybody's not rowing in the same direction. Does it make your job harder as a practitioner and to run a clinic like Legacy? How does that impact you both?
Sure, it absolutely impacts us, especially when the science is ignored. It's different in every city, in every state, in every block, in every community. And it is hard. It makes it harder to get the message out. It makes it harder to get people to believe the message and to actually, believe the science and set the politics aside. But the politics has always been around. It's still around the prevention messages. We still don't have a needle exchange, or syringe exchange program, in the state of Texas. And we probably, we file a bill every year. I mean, every session, never get it. We know that prevents HIV. It's just, until we're all rowing in the same direction, and we don't. So it's frustrating. That's what it is for me. It's incredibly frustrating.
And it is. And I think the bottom line is what I tell my community, we have to do this on our own. We can't depend and rely on anyone else but us. And we have to do what needs to be done. Whatever we can get from anybody else, so be it. And, hats off to Katie and Legacy. You don't even have to ask them. They're already doing what needs to be done. And we have to do it on a community level and hope we get what we need to get from someone else. And, for me, it's a fine line in the sand. You're either part of the solution or you're part of the problem. There's nothing in the middle. And if you're part of the problem, I don't have time to deal with you. We need to do what the solutions are and what we need to do on a local basis. And the good news is we've got excellent local leaders. I mean, Sylvester, everybody locally is trying to pull in the right direction and trying to do what they can, independent of what the other folks are. And so we're lucky in our environment to have people that are trying to do the right thing as best as possible.
And thank goodness all politics is local.
It's interesting when you say that we have to rely on our community. That sounds like the gay community in the 80s when they couldn't get attention. There's one thing that seems different about this pandemic than the other, but you've you noted it when you said that you couldn't get condoms in prisons and you can't get a needle exchange. My thought about that always is because morality, and politics had gotten intertwined, and politicians were making moral judgments about public health decisions. COVID doesn't really have that component. It's not triggered with a high-risk behavior or a community that has a moral component in it. So has it been easier to get funding and treatment, do you think, for COVID than it was for HIV?
Oh, absolutely. No question.
Yeah, there's no sense. But I mean, the one good thing about all of this is that the treatment for COVID-19 is completely free, independent of insurance or whatever else. You can go in the hospital and get first-class treatment for nothing, get the vaccines for free. I'm not sure how much moral that is. I think it's something to try to decrease the spread of the disease process. But whatever reason they're doing it for free, it's a good thing. And so we are getting much more funding. We did not have that back in the days with HIV when we were struggling, trying to, get people medicines or care in and out of the hospital, whatever else. But that has been a benefit, at least so far.
Katie?
Oh, completely agree. I mean, there's a huge difference on that respect.
We have about 12 or 13 minutes. Dr. Gath, I'm going to ask you first, what is it as a medical practitioner that you want people to know that you can dispel either a myth or give people, you have a platform to give people who may not know information that they might need? What would you say to folks who are watching about what they ought to absolutely know and they ought to share?
What they ought to share is the first thing. One, the disease is preventable and we need to take the vaccines for 3 reasons. 1, to protect yourself. 2, to protect around you. But 3, the pandemic is not going to go away unless the virus stops replicating. If the virus replicates, it will mutate and we're going to have a problem. And so the 3 reasons why you do it are for yourself, for your family and your community, but for the entire public health. We're not going to be able to stop this particular disease process without doing that. The second thing is, until we are down in the percentage of cases, we have to wear a mask, no matter if you've gotten vaccinated or not. Because the one thing we don't know if you've gotten vaccinated is whether or not you can still potentially spread the disease, maybe even on a short term. So we have to wear the mask. The good news is there's a light at the end of the tunnel if we do this correctly. Because if we do it correctly, I think by the summer, the fall, we're going to be past the major parts of this epidemic. If we don't vaccinate and wear the mask, we're going to have problems where these mutations are going to get around the protection that we got from the infected people or the protection from the vaccine, and we're going to end up with another surge. And so the important platform to do is it's not hard. Wear a mask, stay as close apart, don't gather until everybody's been vaccinated. And then please, when it's time to get the vaccine, please get the vaccine. And let's get this over with so we got life at the end of 2021 back to close to where it needs to be.
Katie?
Oh, just ditto, wear your mask. I don't care what anybody says. Get the politics out of it, wear a mask.
Getting the politics out of it, we talked about misinformation earlier. I have a quick question. Do you think it's harder, and how do you accomplish? It seemed to me in the HIV pandemic, it was a lack of education. It was getting people educated because there wasn't enough information out there. And now it seems like the dilemma is how to re-educate people who have formed opinions based on misinformation, not just a lack of access to information. They're actually being misinformed. Masks don't work. The virus is a hoax. I remember a really skinny thread of people in the HIV pandemic that would pitch the theory that HIV didn't cause AIDS, but that was short-lived and narrow. It didn't really ever have legs. That's not true here. So is it harder, do you think, to reorient or re-educate people than it is to educate people who are just literally ignorant and don't have enough information?
I'll lead off by saying that the problem is that when you get information overload that doesn't make any sense, you tune everything out because none of it makes any sense. Y'all call me when you get your act together. Wear a mask, don't wear it. And so people have tuned out. They really have, because they don't know what to believe, who to listen to. They hear one thing from this person, one thing from the other person. And so the problem is trying to filter out what the right information is so they're not overloaded with the wrong information. And the hope is that that is changing. I mean, if you look now at the COVID-19 updates from Tony and Walensky and stuff like that, it's like the adults have returned back to the room. I mean, it makes sense. I even watch this. Oh my God, this is really great. And so I think we're getting to where it needs to be, where the misinformation is found out. And hopefully, I'm telling people, you can now tune back in, and here's really what you need to have, and that's what you need to do. So it's not overload. It's just we have to unload what is not true. And I think hopefully we're gradually getting back to that. But we still, not taking away the mask and 100% people at the Astros game. No. I mean, it's just no other way to pay it, but no.
I know, and that's what's frustrating. I think that's what's frustrating for every medical professional, because we know how to stop this disease, and the politics get all tied up in it, and it's incredibly frustrating.
And let me add one other thing with that. The medical response and the doctors and the nurses, we're sort of getting tired. They're nurses that are burned out. They're nurses that are sick. We're having trouble getting staff. We're not going to be able to respond to sick people if we get some other wave at this point in time. So it's simply not going to have the manpower. I've worked now coming up 3 days. I worked 365 straight days. And I'm saying that for the martyr for a cause, because that's what I'm supposed to do. But I'm looking around at the nurse, who are the real heroes. I go in there for a few minutes. The nurse in there for 12 hours cleaning up poop, and the people cleaning the rooms. I have tears in my eyes for the dedication they have, but they're tired. And there's not a second round of docs and nurses coming behind us. And so it's not going to be a pretty scene if we get another wave of folks. We don't have the manpower to take care of them. So that's the other reason society needs to help give us a break, and let's get this over with and move on.
Yep. And people are tired, which is also like, we hear it all the time. People are tired. I'm tired of wearing a mask. I'm tired of it. I'm tired of staying home. I'm tired of not being able to do what I did. I'm tired. And so I don't want to, and so please don't make me wear that mask anymore. And if somebody in authority gives you permission not to, you're going to not do it.
Yeah, I think I know a lot of people who have pandemic fatigue. And it's hard to keep people vigilant and to not be complacent. It sort of reminds me, I came about in a different time in the 80s where we were all freaked out. We didn't know enough. There weren't any treatments. Then you had a younger generation who had an increase in HIV infection because they thought it was treatable and manageable. So they let their guard down. Do you have a concern that when we have more people who are vaccinated, that could repeat itself, that people will get complacent and sort of not worry about it because we have so many treatments and so many vaccines?
Well, they already are. They already are. But they're like, I've heard people, I'm like, well, I'm vaccinated. I don't need to wear the mask anymore. Well, that's not true.
Yeah, it is already happening. So the race is the complacency versus the percentage of people in the community that have the percentage of people that are getting infected and the mutation. I mean, Tony keeps saying, beware the mutation, beware the mutation. I don't know if you saw the data, but it is 64% more infectious and almost 100% more deaths with this particular thing. And it's here in Houston. So if that starts brewing, that's going to be a problem. And, I didn't share this data. People know there was a convention called Biotech in Boston in February, and no fault of their own, and nobody knew what the pandemic was doing, but people went to that convention, and 28 people spread the virus to 250,000 folks. 28 people is 250,000. So it doesn't take 1,000 people to spread the disease. It takes 20 of the wrong people to spread it around. And so that's why this is the time that we can't be complacent. And I'm just praying that we're going to get the vaccines. out and the people are going to wear their mask long enough. I mean, the good news is I think while people, there's a little bit of right, I think the pushback, HEB says no. I mean, that they shut down whatever that party was supposed to be. A little common sense. Houstonians have some common sense, I think, to say, you know what, that doesn't sound right. Let me just do this for a while longer and see what happens. So I'm praying that we'll be able to do that long enough to make this go away.
Be vigilant, because you can see, or at least the science is saying, you can see the light at the end of the tunnel if we can just hang on for a little bit longer.
People don't realize how amazing this vaccine is. The flu vaccine on a good day is 40% effective. To have a vaccine that's north of 60% effective is almost a gift from God. I mean, nobody would have predicted that. And so we have God, Tony, whoever did all the work, gave us something to fix this. Use it, let's fix it, and let's do what we need to do. It's just, it's important.
Katie, we're closing out on time, and if anybody has any questions, I know they can ask them in the chat, but if we don't have any questions, is there something you want to end with or a message you want to send?
Well, my message is get vaccinated when you can. Take your parents, take your brothers and sisters, take your family, get them vaccinated. If you know somebody that isn't able to get on the computer to figure out how to get vaccinated, help them get vaccinated and wear your mask. Just wear the mask. It's not the end of the world to put a face mask on. It's just not. And we can save our friends and our relatives and everybody else, not to mention the medical professionals who have been true heroes in this whole pandemic.
Absolutely. My niece is a trauma surgeon, and I complained about wearing a mask for 2 weeks in a bench trial. I made the mistake of complaining to her. It reminded me that my cross was not that heavy. So it's a good way to end it. I want to thank you both. I want to thank Dr. Gath for all the people on the front line. You talked about nurses, and you also talked about, I know you're not doing it for the accolades, but 365 days is a commitment. And I'll close it with how I opened it. My grandmother would say, you have a servant's heart. And so we appreciate your servant's heart, and Katie, yours, for all the time in our community. And thank you both, because I know you worked as hard as you're working, and you still gave us this afternoon and an hour and 15 minutes of your time, and I appreciate it. And on behalf of the HBA and the LGBTQ plus section, thank you both so much.
Thank you so much. You guys stay safe. Appreciate it.
Thank you. Thank you so much. I really enjoyed it. Joe, good to see you always.
You too, Katie. All good.
Good work.
All right.